Today I don't have my son or a person, but I want to get this done. So anywho, we're gonna use this. Just the best thing I could find. This teddy bear. It has all. It has joints. It's jointed. Anyway, moving on. We're gonna pretend that for the purposes of this video, I'm gonna walk into the room. Obviously, let me adjust it to where you can see him, a little twinkler bear. All right, moving on. Walk in, tap tap. He lets me in. He says I can come in. I do hand hygiene. I come in. Hi, my name is Angela. I am your nursing student. I'm coming to do a musculoskeletal assessment. Is that okay? And they're gonna say okay. They're gonna give their consent. I'm gonna ask how they're doing, about pain, and I'm also gonna check their patient identification on their wrist. Twinkie and Car. That's the teddy bear's name. And 9/7 1998. Okay? All right, so he told me there's no pain. He told me about his allergies, none. And I'm going to explain to him. I'm going to start from your head and work my way down to your feet. If you feel any pain, please let me know. I don't know how in depth. I just watched the video, and I think that maybe the video is too in depth, but you'll be able to critique me and tell me if I wouldn't just I did too much. So anywho, you're gonna walk up to them. Obviously, you're going to once again do hand hygiene before you touch your patient. Patient said it was fine. You're gonna start with the head, and you're gonna grab here, and you're feeling for any type of deviation. Well, before you begin, you also want to check the spine. So maybe you want to go from behind and check to see the spine is straight. There's no curves. If the patient can bend a little, you can check it that way as well. Okay, get your patient, get him or her, this is a him, sit down, and once again, you're going to check the head, and you're going to hold the patient's head, and you're going to look up, and you're going to look down. And all the while, you're going to be paying attention to any wincing, any type of, sometimes it's nonverbal, and you're going to ask, are you okay? You're going to say they're fine, and then you want to do the side to side. Okay. Perfect. And if you can get them to look left and right, that's another good way. All right, next thing you want to do is the shoulders. You want to go up, you want to go down. And you're going to do this bilaterally, obviously. So if you can just start on one. If you're doing the shoulders, you're going to do one shoulder and do the other shoulder. That just makes sense instead of doing one side and then coming back. That way, when you document, you know, okay, it was the left shoulder or it was the right shoulder. So you're going to do that, up, down, forward, up again. You're checking the range of motion. You're going to make your way down to the elbow, bilaterally, of course, and you do the same thing. Flex, extend, flex, extend, flex, extend, flex, extend. Let's check the wrist. You're going to flex, extend, flex, extend, and you're going to hyperextend the wrist. You're going to check the radial, the ulnar, just making sure that the wrist has a range of motion. With your patient lying down, you want to check the hip and the knee, and you're going to flex them. Bilaterally, of course, you're going to start off with one side, make your way to the other. I'm going to have to scoot them back so you can see the foot. And you're going to do the same thing with the foot, also flexion, extension, hyperextension, flexion, extension, hyperextension. Looks like this little guy is doing all right. Once again, you're going to ask your patient, once you finish with checking the range of motion of the patient, making sure there's no lumps, no bumps, no bruises, because of course you can't go without inspecting, making sure that you don't see anything visible on the skin, and you want to make sure also that they're warm to the touch and dry. I forgot what I wanted to say. I said no lumps, no bumps, no lesions, no lacerations. The range of motion is within the parameters of this patient. Age, weight, gender. The complexion matches their ethnicity. So if all that checks out, you're going to chart any deviation of any kind that's occurring with your patient. Once again, you're going to do hand hygiene, and you're going to ask the patient, do you feel any pain? How are you feeling? They're going to respond, the way they're going to respond. If they say no, great. If they say yes, okay, from a scale of 1 to 10, 10 being the worst pain, how do you feel? Where do you feel it? And you might want to add to when Where do you feel it and when do you feel it? Is it walking or anything like that? And that's pretty much it, I think. If not, I'll just redo the video. But before you do your closing, ask your patient, do they need anything? And also explain to them that you'll be right outside if they need anything, and you'll be more than willing to help them. And that's pretty much it.